welcome to Truth Be Told podcast. My name is Erica and this is Brandy.
Hey guys.
And if you're joining us for the first time, our podcast is focused on providing underserved and the underprivileged communities, particular communities of color, with the information and tools to improve their dental health care experience.
Yes, ma'am.
All right. So we are continuing with our restorative health dental care series. And last week we talked about braces. So it's a lot to talk about when it comes to braces. And so this is our second part of braces, right? All right. So it's time to apply the braces. So we're getting the braces on, you're in the chair. What's going to happen?
Okay, so so at this point, everything you needed to do beforehand is done. You got your treatment plan, the financials spoken for, you've had your x-rays and your consult and whatever work you need to have done before you're ready to have the braces on. So they recommend that you take something beforehand because you might be sore afterwards. So like whatever you normally take for a headache is fine. And not every dentist or orthodontist does, but where I used to work, they wanted you to take something beforehand. It doesn't hurt to put them on, just so you know. That's not painful. Just that once your teeth start moving, you may be a little bit sore. So within a couple hours or so. So they're going to take the separators out. We talked about the separators lastly, and then they're going to place bands on the molar teeth. So they're like circles, they like a metal circle, and you're going to have 4 of those put on, one on each first molar. Sometimes they'll put them on your second molar if you have them. So if you're an adult, they may put them on your second molars. If you're a child, you may not have them yet. So they use the molars to anchor. They'll put those on, and then once you get a good fit, they will cement them. And they'll put the cement on, they'll let it sit, they'll clean the cement off. And then from there, they'll start to put the brackets on each tooth. If you have the ceramic ones, which are the clear ones, or if you have the metal ones, there's cement placed on each bracket, and each bracket is placed directly on your tooth in a particular position. So it's positioned very strategically the way the dentist wants the teeth to move. So what they'll do is they'll cement all of them. They use a little light to like a blue light to harden the cement so that it's set, and then they put an arch wire in. The arch wire is usually very thin and flexible at first because you want very minimal movement in the beginning. So it's just to kind of get you ready. As you go on, week after week, they will change the arch wire depending on how the doctor wants the teeth to move. And sometimes it's a very thick and heavy arch wire. When they're heavier, you'll have more movement. Sometimes they're thin and flexible. In the beginning is thin and flexible. So they'll place that, and then you'll have your ties to put around them. You can pick the color of the ties. You can just keep them the color of the brace so that they're less noticeable. But kids usually like to have fun with it, and they'll choose different colors. So the colors, Erica, okay. I've never got the colors because I was an adult, but I used to be an orthodontic assistant, and I would put the colors on the kids, the little ties. If you have the ceramic ones, it's usually tooth colored so that you can't notice it. Obviously, you wanted the clear ones for a reason. So, Yep. So put them on, and then you will start having your teeth move once they're on there. So that's the very beginning, and then you will come back every 4 to 6 weeks for adjustments.
But do they know how long it's going to take? I mean, obviously, if you're not doing what you're supposed to be doing or coming in for your appointments and everything like that, but generally, if they know, they see your teeth, do they say, okay, this is how long you're going to have these on for?
So they'll give you an estimate during the treatment plan. So you'll know how long, but that can be adjusted shorter or longer depending on what's going on. Like you said, depending on you, depending on things that come up. If you're an adult, you may be very picky and you want certain things done a different way. And then, so that's going to take a little bit more time. Or if you're a kid or an adult and you're just on top of it, you're always there, you're doing the things you need to do, then you may get done sooner. It just depends, on what's going on.
So at that point, what do they, when they're putting the braces on and they know you have the overbite, the reason why you're getting the braces is to correct that, right? Am I right in that?
Okay. Yeah. So like, you want to be aesthetically pleasing, but it's also a functionality thing. So typically that first part of the treatment is like aligning and positioning the teeth. So we want to straighten them and position them and align them. And that step two is when, like you said, we're dealing with other things. So like an
Okay.
open bite or an overbite or overjet or whatever the issue is, crowding. If you have a lot of spaces in between your teeth, then we're going to start to address them now that the teeth are aligned. Um, and in like the position that the orthodontist wants him to be. Then he'll start dealing with any bite issues. So with this, Erica, if you had an overbite or an overjet, they would probably use rubber bands, and you would probably have to change rubber bands often for a period of time.
Is that where the
Um,
rubber bands go here and they go down here or something like that?
right. So there, but it's different for everybody. So for you,
Okay.
you probably had to have them there, but you wear
I
them for certain. Yeah.
I
So that
definitely have rubber
addresses the bite.
bands.
That addresses
Yeah.
the bite. And then they'll do other things too. So that's what we're doing in that part of treatment, making sure the bite is on point. Now sometimes they wait to have extractions done. Um, so you may be getting extractions in this phase depending on what kind of treatment you're having. Sometimes they wait. So it just depends. But this portion of the work is going to focus on any bite issues
Okay.
that you might have. And that you'll know what that is, during the treatment plan.
Okay.
And I think also, they'll close spaces as well. So by this, when this is all done, you won't have any spaces and you shouldn't have any crowding. Everything should be getting nice and straight for you.
So they spend the next final months of the braces tidying up the fine tuning and the alignment and the bite, right?
Absolutely, yes.
Okay.
Yep, he'll do that. He wants to make sure, they're at the most optimal position. If there's anything that you as the patient don't like or want something changed, or if, there's a little space here or you want a tooth turned here, these are the little different things that we'll do. Basically, at this point, you're going to look at your mouth and be like, it looks great. You're going to think it looks great like probably like 3 to 4 months after you have them on. It moves really fast, but it's the other things that you can't see as the patient that need to be addressed,
Mhm.
like the bite issues and these different little fine tuning things that the orthodontist wants to make sure that everything is looking good and that is your bite is functioning properly. So we want it to look good, but you also want to be able to function as well. So this is, like you said, tidying it up, and then depending on what you're having done, like depending on your treatment plan, you may or may not have a fixed retainer or a removable retainer after your braces are removed. So once that fine tuning is done, you're good to go. It's time for you to get your braces off. The dentist will remove them. They'll smooth off the extra cement on your teeth, and then you will get a retainer. So they usually take the molds for the retainer before you get them off so that you have something to put on. Or sometimes they wait and then you just wait a week before you have them put on. But I know for me, I had
Listen,
a regular, and I still wear my retainer like 2 to 3 times a week, like at bedtime. So I have a spring retainer, which is an adjustable one that pops in and pops out. Some people have a bonded lingual retainer. So that's one that's actually cemented on the backs of the teeth to keep the teeth from moving. Those are usually people who had a lot of spacing, a lot of crowding, different things going on. And that will be discussed in the treatment plan as well. So you'll know what his plan is for that when you're finished. I just want to say that if you don't have a bonded retainer, one that is cemented to your teeth, which by the way, it takes a lot of care. So you still got to floss your teeth, and it's not an easy feat with that bonded retainer. So I'm not a big fan of it. Like I didn't want one. Um, I just wanted the regular retainer so I can clean my teeth properly without any hindrance. But you all have to wear your retainers for the rest of your life. If you have braces, you really should be wearing them. Otherwise,
so
if you don't, your teeth will shift and move, and that they just have memory. Teeth have memory, and a lot of times they will go back. Especially if you have a really difficult case, they may go back. Um, but yeah, so I've been wearing mine. I mean, at first you wear it more frequently. You'll wear it every day for the first 3 to 6 months, and then after that, just at bedtime, and then after that, like after not having braces for 20 years, like I said, I wear them to bed maybe 2 to 3 times a week. And I'm wearing this, the same retainer that I had 20 years ago. So it still fits and I don't have any issues. I'm trying to think. There was something else. Oh, yeah. Just so you know, when the braces come off, it's really quick. It doesn't take long. They usually pop off the bands and it comes off in one piece. So it's not a big thing. The most time is going to take cleaning cement off and they'll use like a hand piece to do that. Um, I'm trying to think. I think after you get the braces off, you see the orthodontist 6 months, 9 months, and then at 12 months. And then after that, they send you on your way unless you're having an issue or anything like that. But you always bring your retainers to your follow-up appointments because they sometimes want to adjust them.
Care. So we're all done with braces. It's a lot of steps.
Yeah,
You're
so many.
fortunate to get them if you can. It's good. It's a great thing.
Yeah, actually, Erica, you know what? We didn't even quickly just cover costs because if your insurance doesn't cover them,
there's
you
that.
can be paying it from like $5,000 to $7,000 for it. And typically, your orthodontist they do like payment, like you can pay monthly usually. But your insurance may cover adult ortho. You just have to check. But typically, kids will be, but adults usually aren't. It's not, a good $5,000 to $7,000 per case.
Okay. All right. Well, once again, thank you so much for all your knowledge and all the information.
No problem.
We so appreciate it. I do as well because some things I don't know, or this situation, I didn't remember some of the things. So you guys, thanks once again for joining us. Tune in again next week we're going to talk about Invisaligns. So the pros and the cons. So, follow us on Instagram. Go on to our website. It has all of our socials on there, truthbetoldpodcast.com, and get all the information you need.